June is Men's Health Awareness Month, and this morning we're going to talk about some exercise habits for men and some tips for every decade. And so we are so lucky. Today we have primary care sports medicine physician Dr. Nader Ayub here with us to talk about all of these things. So doctor, thank you so much for joining us.
I appreciate it.
Yeah, this is a very important topic and discussion. It affects men of all ages. And to kind of break it down for us, the benefits of exercise for men.
Yeah, so big benefits, both physical and mental. So physically, this can help reduce your risk of heart attack, stroke, diabetes. Mentally, we've seen that for younger men, helps decrease the risk of mental health disorders like anxiety, depression. And then as we age, there's a lot of benefits with exercise and age too, such as decreasing your risk of Alzheimer's or dementia.
Yeah, I mean, the risks are through the roof, basically, of what you should do there. So I know one of the big questions that I always have, which I'm sure many men do as well, is what is the ideal amount of time that you should be exercising? What should they aim for?
Yeah, so the CDC recommendation for the amount of time of exercise is going to be 150 minutes a week of some sort of aerobic exercise. The thought with that being that if you can do ideally 30 minutes a day, 5 days a week, sometimes life happens. We can't always exercise every day. So if you can also put it into blocks, but make the cumulative amount 150 minutes, then that will have a lot of benefits on top of at least 2 days a week of doing some sort of strength training exercise too. And the big things with exercise is that you also want to do things that you enjoy. So, if you don't enjoy running, that's okay. I mean, you could do other things. You can bike, you can swim, you can row, or you can even just walk, and the type and amount of exercise that you want to do is going to be more moderate intensity. So enough where you get your heart rate up a little bit, just so you're starting to break a little bit of a sweat. And then with strength training, it doesn't necessarily even have to be that you have to go in a gym and throw a bunch of iron around. You can do like resistance bands training, things even like yoga, Pilates, Tai Chi. Those provide good strength benefits. And a lot of these are like the minimum amount you want to do. The more you do, then the more benefits you'll get from it. But at the same time, you want to keep an appropriate balance, because not only do you want to exercise, but you want to have time with recovery too, because that's going to be key when you get the benefits, is the amount of recovery and rest that you get.
Absolutely. Well, you said it. Recovery is important. They can put stress on your joints in some instances. So how should men go about preparing their bodies before exercising?
Yeah. Especially in those who are older, it's good to, if you're starting a new exercise regimen, to consult with your primary care physician just to make sure that it's safe enough to do certain types of exercises, especially as we age. And then once you get the clearance and you want to start getting back into it, big thing is that you want to do a ramp up period for it. So you don't want to just go into the gym and start throwing on 300 pounds of deadlifts and start ego lifting, because you will certainly increase your risk of injury doing that. So you want to do a gradual amount of ramp up. And when you start, you want to get a good period where you're warming up, doing some stretching, perhaps doing some dynamic type exercises, then gradually introduce that. And then as you go on with your exercise, you can slowly increase like the amount that you do in it, and that would help decrease like your injury risk. And at the same time, like, it's important to have a good like cool down period where instead of just stopping right away when you exercise, kind of gradually come down from it. So that'll help reduce your risk as well.
Absolutely. Doctor, what age would you say that men really need to start focusing on changing habits?
Yeah, really it's in all ages. You start out young and you start introducing habits, that's great. 40 is a good marker too, where you would start to say, well, if I haven't done any kind of exercise before, I really need to get into it. So what we see after the age of 40 is that your body goes through some effects called sarcopenia. And basically what that is that your lean body mass starts to turn into more of a fattier type substance. And that decreases as we age too. So we start to see 1 to 2% decrease in lean body mass, as well as a 1 to 5% decrease in strength. And though we can't stop Father Time, we can certainly slow down its ticking. And so if you really haven't done anything before and we start getting above 40, we really need to get focused on that and start introducing some sort of exercise program.
For those who may be a little intimidated by exercise or this just feels daunting to them, what would you tell them? Because I know we know a little bit really adds up, or something is better than nothing. So what would you tell them?
So, for some, it can be a little bit intimidating going to a gym,
Right.
Especially you look around, you see people throwing up big weights, and you can get a little self-conscious about what you're able to do. I think the key is trying to get over that hump and understanding what you can do and listen to your body and understand that you can't just go in right away and do the types of things that other people are doing around you. And going back to what I was saying again, do the things you enjoy. You don't want to make exercise a chore. I think the big thing with exercise is if you can integrate it into things that you like, and it could really be anything where you're moving around. So for an example, like for myself, I do strength training about 4 to 5 times a week. I've enjoyed doing that. I don't love running, but I understand the importance of getting some sort of aerobic activity. So for myself, I enjoy playing pickup basketball with my friends. For my 2 boys, Dean and Sam, I coach a lot of their youth sports, so I'm out there walking around.
Yeah, that counts too.
Yeah,
right.
exactly.
Absolutely.
And I have a newborn daughter, Rose, but she's 1 month old, so there's not, her activity is going to be more of a physical exhaustion for myself.
There you go.
But it's important to I think that I hear that a lot with some that they say it's hard to exercise because life gets in the way with work. And I think just finding ways to integrate that where you can do something is more important. So as long as you're moving around, then I'm happy with that.
Absolutely, Doctor. As you said, taking care of yourself mentally and physically, so very important. So thank you so much for those tips. They're very helpful.
Yeah,
We're
absolutely.
grateful. Dr. Nader Ayub, thank you.
Thank you.